Thank you for being with us and taking active participation. I think when we talk about care, we always think about giving care, taking care of another person, isn't it? But I think the COVID pandemic really gave us a glimpse of what actually carers can also go through. In the sense that we really had a very different and a very unique and probably a very painful experience also during COVID in terms of how much um, suffering all the sides of this team, this teamwork can go through. And I think that there is also evidence that unless you take care of yourself, you will not be able to take care of another person. So it is very important that you're aware of yourself, you're aware of your own strengths and weaknesses, your limitations, and how to take care of yourself so that you can continue with the journey with the person. I think shared journey is very important. The shared journey of carers with suffering. This leaves an impact on us, like we have been talking about having tender conversations. And though tender conversation sounds very nice, it is also very, like we see, it's very difficult as well, isn't it? It also has a lot of effort from us, hard work, leaves with a lot of emotional reactions, not only for the patients and the families, for ourselves also. We leave sometimes with very difficult kind of emotions from a scene. Sometimes we take these back home, and sometimes it impacts on the family as well. Managing difficult symptoms when a person has resistant pain, difficult pain, or resistant symptoms, and when you're not able to really give them complete relief, that actually hangs as a burden within you. How am I going to sleep when somebody else is suffering with pain? Facing challenges ourselves, facing challenges in the team that you work with. That's very important. When you're working in a team, what are the challenges that the team faces when you want to work together harmoniously, in synchrony, to reach the goal of the team? All this, and the losses that we face. I think again the COVID 19 pandemic really brought us to that situation where you saw losses in different dimensions. There was, I think, every dimension of the life, whether it's spiritual, whether it's as a physical loss in terms of the suffering that people had, losses of people, deaths. See, losses only not only by dying. Loss can be as in a role, in whatever your identity, whatever dimension in your life, property, job and employment. You see people losing places, people migrating from one side of India to another. So much of loss, which was almost a devastating experience. And finally, I think in palliative care, especially, and I'm sure in many specialties where you see so much of morbidity and mortality, the talking about death and dying and aftermath of dying, when you lose a person that you're caring for, and then you want to do, look at the grief of that person and bereavement. All this actually leaves an impact. It leaves an impact on everyone who's involved, and it's very challenges each leaving an impact. So how do we be aware of these, understand and respond? I think it's important to be aware, because we kind of sometimes get so engrossed in our work and we continue to do our work without taking a space for ourselves. So in one way, the COVID 19 actually put a stop to our pace, isn't it? That rush that we had, running behind things, it really restricted us. In that way, it was actually giving us an time to reflect on this as well. So about loss, I just want you all to just reflect on the journey of a person with chronic illness and what has been the impact of this journey. Just take a few minutes to reflect. I'm not going to ask you, but probably later when we are discussing, you can bring back, in the sense that for each one of us, the loss of a dear one, or in the team that you work with, of a chronic person with chronic illness, would have left impact in a different dimension. So it could be like, as a physician, probably as how difficult it was to manage the symptoms, or, a personal loss in the family. I mean, losses has happened in different ways. So it will really impact you in different dimensions. So just to reflect that, only when you reflect, you can empathize with another person who has had a loss. So what has been the impact of this journey? Because caregiving is actually a balancing act, isn't it? You have to really be very careful about this. You have the caregiving stressors. You have to follow a schedule, you have a role, you have a team, you have so many deadlines to meet. Other than taking care of the persons, you have teaching, so many stressors. As a primary caregiver, a wife, like, like Anwar had so much of stress in not only taking care of the financial aspects, but also taking care that Subeda is not getting affected by this, taking care that you're not giving her bad news. So many stressors for a primary caregivers. Secondary stressors coming from that in terms of financial, the social, losing a job, unemployment, life events that happen, change. You might have a place to, like Moira was saying, people come from Northeast to here and they sometimes have to be here for a long period of time. And what are your internal coping resources and external coping resources? How strong are you? Remember Julesna asking that, has Suveda gone through a similar experience before? So how have you faced challenges in your life? How have I faced challenges? That gives me inner kind of, when I look back on it, I see that I have crossed those hurdles. I will be able to do that. That is the inner coping strengths, your personality, your traits, and then external coping mechanisms, your family, your friends, the society, the team that you work with, and of course your faith, most importantly, the spiritual strength that you get from God and other, the faith that you have. Because after loss, especially if it's following death, there is the immediate loss of death itself causing a lot of things, and then there is a secondary losses. You yourself, when you lose, you have the loss. I'm sorry, can you see that the second blog? I'm not sure whether it's very clear. There's a loss of a role as a caregiver and the support of the care team, and there are further losses, I think very important in terms of hopes, dreams, income, and roles, and each of these require adjustment and adaptation. And we go through varied range of emotions when losses happen, don't we? Sadness, crying, tearfulness. That's the probably the commonest way that we express, especially in our culture. Crying is easy. We express, the crying comes very easily even when we are in a crowd. We cry a lot. Anger, shock, bewilderment, numbness, you know, dazed and despair, alarm, where you are agitated, when you feel that, the person is going to shock, or even sometimes red alert signs like a person is feeling suicidal or saying that I also wish to die. I don't want to face this anymore. So, like Moira said, the depression and the anxiety and the very severe kind of emotional reactions where you think that the person needs immediate help. For some people, it is acceptance, it's about love. Like Mr. Karthik, he understood that his life, he has done enough, he has to now slowly let it go, and he was turning into faith. So then getting, in harmony with his spiritual support. But then we know that there are many reactions elsewhere also. We saw the stigma which came in, especially stigma. I work with people with chronic mental illness. They face a great deal of stigma. So that kind of emotional reaction, and that itself is a big loss, that you lose your identity, your role in the society. You lose that connection with people in terms you're so isolated. That happened in COVID as well. And we see this person who's in a corona lift. This came in the newspapers, and they're so isolated. The director also mentioned that, COVID brought about that kind of a reaction. But there are people who have this with other illnesses also, not COVID. People with HIV, chronic mental illness. Many of them face this kind of a stigma. Also in teams, I want to just highlight this. There can be so much of pressure. For example, the nurse breaks down and says, whatever I do doesn't seem to help anyone, neither the patient or the family. She adds that my life is worthless. So uh, this is in the context of the COVID, but this can happen at any point also. Like when you're going through difficulty, either she says that I haven't got my salary for the last 3 months. That was during COVID times. But or if a hospital is going through difficult times and they are not paid well, that is also. So what are the issues that you focus on these situations? So this is an important aspect that we have to be aware of. Burnout as carers, an important role that we play is always trying to give other people something. rather than taking care of ourselves. And when you continuously keep caring for others, giving, there is a point where you feel emotionally exhausted. There is a feeling of energy depletion or exhaustion. And then that kind of makes you suddenly a bit detached. You feel depersonalized. That means that you feel that there's an increased distance from what is happening in your team, in your job, or even sometimes that leads to a feeling of negativity and cynicism. Why am I doing this? This doesn't have any meaning. I've been working all through this life. This actually has no meaning or purpose. I've been just running around nothing, and also feel that I'm not doing enough. There is a sense of low efficacy, low personal, professional efficacy. So, all this together is called burnout. So, I'm sure that all of you are familiar with the term burnout, but then we have to understand the components of that, because we are also aware, and because of our very, very fast pace of life at work, we should be aware when the warning signs come, because if you're aware, then you can take, whether it's for yourself or for the team. And of course, spiritual distress, very, it's a such a vast kind of dimension that it's very difficult to limit it. And you have to there's so many components that come in this. For the patient, the affirmation that the patient gets, forgiveness, depending on his life, reconciliation, meaning, relationship with God, the fatalism. For the society, for the professionals, hope, so many aspects of spiritual distress. Just a few more slides about strategies for self care. So, try to be aware of that there are ways that we can be aware of ourselves. And Moira will be talking about it more, about how we can follow a healthy lifestyle. I'm sure that many are doing that now in terms of diet, exercise, and all those things. People are more aware, but be very conscious about it. Have hobbies that make you feel happy when you don't have to be always working. Take time out, spend time with your family, friends, have healthy relationships, and have regular appraisal at work. Be have a mentor in your team, so that you get good supervision and feedback. That is a good way of actually, and when you have a difficulty, you actually go forward also with this. I know that CMC has a good concept of this foster parents and foster child, that we have that in Believers Church as well. I think it is a wonderful way of keeping that child in the campus as safe as possible, with giving them help. And professionally also, so when you have you have to maintain the balance of enhancing your skills, your competency to communicate, as well as to in your role, to develop in your role. I want to just say this. This was a slide we prepared for COVID-19 in terms of staff support, because that was a time we really had this issue of how staff were continuously feeling demoralized, burnt out, and there was a sense of compassion fatigue and moral distress. Moral distress in terms of not able to really do what you want to do for a person. So you're morally distressed when, like when people were dying and ICUs didn't have bed, but you wanted to admit someone, then there's a distress in saying that you don't have enough beds. So there have to be strategies as an organization in terms of empowering, providing safety, equipments. The team leader has how they have a strategy, and the individual, as I said, very important in terms of a team and an organization to take care of this. And finally, I think it's the meaning and the purpose that you can bring in your life in terms of spiritually and emotionally, words, connecting outwards and connecting upwards. I think three directions which mean very different, but all merge together to bring in some harmony of meaning and purpose in your life. So I'm going to hand over the dais to Moira to continue on.